Well, thank you, Provost Cottrell, for those kind words. Can everybody hear me okay? I suspect I probably don't need the microphone, but hey, I just want to begin by thanking Dean Newell and the faculty and staff here at Booth Library for sponsoring this exhibit for all the people, a century of citizen action in healthcare reform. I think we can all agree, as I'll emphasize today, healthcare reform is a critically important topic in contemporary society. And I certainly want to also thank Dean Newell and the faculty and staff here at Booth Library for giving this opportunity to speak on the social determinants of health. Now, I want to begin by answering a question, that is this. Why invite a sociologist to deliver a keynote address on issues of health and healthcare? Or allow me to rephrase it. Why make the wise decision to invite a sociologist to speak on issues of healthcare and healthcare reform? I mean, it would seem obvious to invite a physician, some other healthcare worker, a political leader, an activist. But seriously though, I'd like to hope it had something more to do with the fact that I was available this afternoon. There's more to it than that. But, in all seriousness, what I hope to demonstrate today is that sociology provides a very important perspective for understanding issues related to health, illness, and healthcare reform. And it's a perspective that needs to be used to inform public policy, along with other social science perspectives that the provost had mentioned. Now, more generally, sociologists like myself have had an interest in healthcare for a number of reasons. I mean, certainly the healthcare institution over the last 100 years has become an incredibly important, powerful social institution, evidenced by the approximately $3 trillion we spend every year on healthcare. And then if you look at the very subject matter of sociology, right? I mean, we are interested in studying society, and for there to be society, right, this requires reasonably healthy individuals. And as a consequence, sociologists have an interest in understanding things related to health lifestyles, illness behaviors, and so forth. And as I'm going to focus on today, sociologists and social epidemiologists have long pointed out that the social conditions in which we live our lives, that is to say the opportunities we may or may not have, the communities that we live in, the social support networks that we have or may not have, all impact the likelihood of us experiencing disease and illness. In other words, as the title of my presentation suggests, there are social determinants of health. Right? There are things in the social structure, in society, tied to our social, economic, and environmental conditions that impact health outcomes. Now, with that in mind, I'm sorry. With that in mind, if you think about it, over the last century in the United States, we have traditionally looked to the healthcare institution as the driving force for both protecting and improving health outcomes. We've turned to physicians, other healthcare workers, hospitals, and so forth. And of course, the healthcare institution has been incredibly successful in improving health outcomes, evidenced by things like, and I won't go through a whole list, but the creation of antibiotics and other pharmaceuticals that have done a lot to improve the public health, vaccines and vaccination programs, sophisticated diagnostic tests and medical technologies that were unthinkable even 50 years ago, and certainly surgical procedures that, again, weren't possible 20, 30, 40, 50 years ago have helped improve health outcomes. I mean, these are all the things that we're spending that approximately $3 trillion on each year. Yet there still has been a constant call for healthcare reform, again, as evidenced by the exhibit here at the library this semester. Now, when you think about these calls for healthcare reform, at the core, right, the kind of basic push is about getting people access to healthcare. And that's also related to affordability, I understand. But it's about getting people access to healthcare. And so this then leads to the question, why? Why is that important? Well, presumably, access to healthcare is going to help improve people's lives, improve their quality of life, improve their health outcomes. So when we talk about healthcare reform, one thing that I want you to keep in mind, and as I begin to focus more specifically here on the social determinants of health, as we talk about healthcare reform, right, the basic focus, right, the core issue is improving health and health outcomes. Right? It's about trying to improve public health. Now, having said that, over about the last 20 plus years, there's been an increased recognition that if we want to improve health outcomes, we've got to move beyond a focus and reliance just on the healthcare system and just on the successes that have occurred within the healthcare institution. In other words, we need to also address those social, economic, and environmental factors that impact health. And indicative of this, just paraphrasing from a couple of different studies published in two prominent medical journals, which you may have heard of, research published in the Journal of the American Medical Association and also in the New England Journal of Medicine have concluded that while access to health care is important to health, it is a relatively weak health determinant. Rather, it's health behaviors, right? It's decisions about diet, exercise, smoking, and so forth that are critical determinants of health outcomes. And whatever health outcomes we look at, whether it's something like mortality rates, life expectancy, morbidity rates, health status, and so forth, influenced by those lifestyle factors. Now, I'm not trying to suggest that healthcare doesn't play a role, but as these studies show, it's a relatively weak determinant. And as any sociologist would tell you, and hopefully students that have taken a couple of sociology courses, including those in my introductory level course, they should be able to note that our behaviors, our lifestyles, including our health behaviors and health lifestyles, are influenced by social and economic factors. Right? That's what's driving our behaviors. Now, this whole this whole framework and this understanding of healthcare being a relatively weak determinant of health outcomes, I think is best reflected in a statement I have here, and hopefully it's going to show up, from a social epidemiologist, Professor Akira Kawachi, who's a social epidemiologist at the Harvard School of Public Health. And I like to use this because I think it kind of cuts right to the crux of the issue. As you can see, right, he states that healthcare can deal with diseases and illnesses, but a lack of healthcare is not the cause of illness and disease. It's like saying that since aspirin cures a fever, that the lack of aspirin must be the cause of the fever. And we know that's not the case. So again, I'm not trying to suggest that access to healthcare is not important. It is, right? But it's one piece of the puzzle. And we have to broaden our focus, right? And think about those behaviors, those lifestyles tied to our social, economic, and environmental conditions. If we really want to not only understand health outcomes, but ultimately try to improve health outcomes. And this has to be a focus of our efforts related to healthcare reform. And certainly this emphasis on the social determinants of health is something that's been emphasized for about the last decade by the World Health Organization. And they've taken obviously a global focus in talking about this need to address these underlying social determinants. It's also been a focus as of late by the Department of Health and Human Services and their Healthy People 2020 campaign. And just as a point of clarification, and I may not have mentioned this at the outset, and I apologize, most of my remarks and my discussion here of the social determinants of health is going to focus almost exclusively on what's going on in the United States. Although this certainly has application for other countries around the world, certainly other developed or industrialized nations like the United States, but increasingly also developing nations. Okay, so with that kind of setup and understanding, okay, healthcare is important, but we know it's not one of the kind of underlying causes of disease. Let's talk a little bit, let me try to explain specifically what I mean by social determinants of health. So when we're talking about social determinants of health, and I'm doing my best just to stand right here. I'm one of those people when I teach, I'm moving around a lot, and she asked me not to move around too much because videotaping. So if I seem like I want to, it's because I do want to move around. All right, so when we talk about social determinants of health, right, these are the social, economic, and environmental conditions in which we're born, we grow, we live, we work, and we age. Okay, that's fine. That's a nice kind of broad, one-sentence textbook definition. But what does that really mean? Let me go through some specific examples of what we get from the research relative to these social determinants of health. So this includes things like availability of resources to meet our daily needs. And by that I mean things like, do we have access to safe housing? Do we have access to a relatively nutritious diet? Right? Do we have access to, and here's something that's been a challenge in some communities, I'll point to Flint, Michigan. Do we have access to things like safe and clean drinking water? Right? These things are important when we're talking about health outcomes. So it's having these resources to meet daily needs, whether it's where we live, the foods we eat, the water that we drink. Certainly, access to healthcare does matter. Right? It's a relatively weak determinant. But when we do experience illness, right, we want to be able to engage the healthcare system. Certainly, engaging the healthcare system is critical in trying to prevent disease. So that is an important social determinant. But it also includes things like social support networks. In other words, do we have friends and family that we can rely on? Not only when we're sick, but just dealing with what sociologists might call the daily hassles of life, right? The struggles, the stressors that we all experience. Having social support networks that we can rely on, critical in improving health outcomes. And research is showing much more powerful than people had originally anticipated. So it includes things like that. Certainly as a sociologist, I'd be remiss if I didn't mention socioeconomic status, which is just really our fancy way of talking about social class position, which again influences opportunities, and as I'll come back to, impacts health outcomes. But it's also the communities that we live in. The provost mentioned zip codes. This is one of the ways we measure this, right? By looking at zip codes, and there's a relationship between the zip code and health outcomes, right? The communities, the neighborhoods that we live in, and the surrounding physical environment. I mean, does one live in a neighborhood where there's social disorder, where there might be increased exposure to crime, to violence? If so, that has consequences for health, right? Both in terms of creating long-term stressors, but certainly the possibility of violence or being a victim of crime. And related to that, might we live, or do some people do, live in communities where they're going to be exposed to environmental hazards, where there's air pollution, where there's water pollution, which collectively can and do have consequences for health. So again, we've got to broaden our focus. We've got to think about these things out in society and these kind of social and economic conditions. Right? Do we have access to meaningful employment and other economic opportunities? It probably wouldn't surprise you to know that people that are employed, generally speaking, tend to be healthier than people that are not employed. And people who are regularly employed in stable jobs, healthier than those in part-time work and so forth. Right? Another important social determinant. Another area that's been the focus of quite a bit of research over about the last decade has been the experience of discrimination and racism. And unfortunately, as we know, there are very real problems with discrimination and racism in the United States. And what the research is showing is the objective and subjective experiences of discrimination and racism, whether they're at the individual level or an institutional level, have consequences for health. They create long-term stressors, which can lead to negative health outcomes, increased likelihood of disease and illness, increased likelihood of a shortened life expectancy. In fact, the term that's being widely used now in social epidemiology is simply something like discrimination stress, right? The stress that evolves from unfair and unequal treatment. That is certainly an important piece of our understanding of the social determinants of health. And it also includes educational opportunities. Do we have access to education, the knowledge that comes with education? This is also one's level of education, another powerful determinant of health. And it works just like you might think. The better educated one is, the better, generally speaking, their overall health. That's another important social determinant. Now, all of these social determinants, and then there are probably others we can add, but I've tried to capture here the 8 major social determinants of health. All of these are important, but as it turns out, some are more important than others. And what I really want to focus on now as a social determinant of health, you might know where this is going, if you've ever had a sociology course, is on socioeconomic status. Because it turns out that socioeconomic status is the strongest, most consistent predictor of health outcomes, regardless of whatever measure you look at. You look at life expectancy, you look at an infant mortality rate, you look at subjective health status, you look at morbidity rates, right, or rates of illness and disease. Socioeconomic status, strongest, most consistent predictor. As I think I said a moment ago, for those of you who might be less familiar with this term, this is a composite measure that we use for talking about social class. When we talk about one's socioeconomic status or his or her social class position. Right? And it matters. Right? It impacts health. And it impacts health in a way just like you might expect. Those at the top of the social class system, right, at the top of the stratification system with the highest SES, have better overall health, longer life expectancies, reduced rates of disease and illness than those at the bottom of the stratification system. Right? Those with lower SES who have shorter life expectancies, more likely to suffer from both chronic and infectious diseases. However, one thing I want to emphasize here is this is not just something like rich versus poor, or upper class and lower class. There is actually what we call an SES, a socioeconomic status gradient in health. In other words, as you move down the stratification system, health outcomes get worse. That is to say, those at the top, longest life expectancies, best health, which is better than those in the middle of the stratification system. And those in the middle tend to have longer life expectancies, better health outcomes than those at the bottom. Right? There's a gradient. And so the other way to say that is those in the bottom have poorer health outcomes, right, than those in the middle. Those in the middle have poorer health outcomes than those at the top, right, of the social class hierarchy, right, of the stratification system. So socioeconomic status is a critically important social determinant of health, as I said, most consistent, strongest predictor. And I want to take a few minutes and kind of explore how and why that is. And in so doing, try to emphasize the importance of a focus on social determinants of health. And we just kind of use this, right, socioeconomic status as an example, right, of the importance of the social determinants of health, although as I'm also arguing it probably is the most important social determinant of health. So let me start here. Take a health outcome, any health outcome. I have some examples there. You can look at life expectancy, you can look at morbidity, you can look at health status. You can be specific, in fact I will. Let's just hypothetically say the health outcome we're interested in is heart disease. Now we know that any health outcome, in my example here, heart disease, is influenced by a number of lifestyle factors. Some things I just mentioned a few moments ago. I saw you shaking your heads. Oh yeah. Influenced by things like diet, exercise, smoking, right? These behaviors, these lifestyles, these kinds of things, right? So it's stress, it's access to healthcare. I'm going to add it's our neighborhood and physical environment, right? The communities that we live in. We talk about these things, right? These behaviors, these lifestyles, as the proximate causes of disease. They kind of immediately precede what we're interested in, the health outcome, right? So we say like, okay, heart disease is influenced by the food we eat, whether or not we exercise, our decisions about smoking, our ability to cope with and manage stress, whether or not we're able to engage the healthcare system, things related to the communities that we live in. Here's the important thing, and I think you probably know where I'm headed with this. What influences decisions about diet? What influences decisions about exercise, smoking? All of these things are impacted by our socioeconomic status, right? By our social class position. Now, think about this for a minute. Take something like diet. I would suggest to you that most Americans, maybe not all, but most Americans have a pretty good understanding of what a reasonably healthy diet is and know the kinds of things we should be eating. And look, I don't eat all those things either, but we generally understand what a healthy diet is. However, understanding is only one part of the issue. As I often challenge my students to think about, can everybody afford a reasonably healthy diet? Maybe not. Next time you're in the grocery store, pay attention to the prices of things. And the things we're told we should eat, the relatively healthy alternatives, tend to be more expensive, right, than low-cost, less healthy alternatives. And if you can imagine a situation there, if you're somebody who's a member of the working class with limited financial resources, trying to feed a family on a fixed budget, that's going to shape decisions about diet. You may know that you need to eat these other healthier alternatives, but economics might dictate, right, that you're going to go with the less healthy alternatives. Does that make sense so far? Now, related to that also is not only being able to afford a reasonably healthy diet, and some of you may have heard of this, it's about having access. Is there a grocery store in your community where you can access fresh fruits and vegetables and all those kinds of things that we should be eating? And unfortunately, the reality is not everybody has that. We see problems in inner cities and in rural communities when you get outside of places like Charleston, Illinois, where there is a distance, not just a social distance, I'm talking about a physical distance, to get to a grocery store, to access a reasonably healthy food. And the concept that is used, and you may have heard of this term before, what's sometimes called a food desert, right, where people live in communities where they don't have easy access to grocery stores that have a wide array of healthy foods, right? That's influenced by socioeconomic status, right? Same is true when we talk about things like exercise and leisure time exercise. You know, again, if you're a member, you're at the top of the stratification system, you've probably got the resources, not only financial, but the time to engage in leisure time exercise. You can belong to a gym, maybe you can have a personal trainer, all those kinds of things. We can imagine a member of the working class, working 2 jobs with a family, and difficulties with daycare, maybe not going to have the same amount of time available to engage in leisure time exercise. It is, somebody mentioned in a presentation I did similar to this a few years ago. They said, oh, yeah, but Dr. Hendrickson, everybody can take a walk around a neighborhood if your neighborhood's safe, right? If it's not characterized by high crime rates, violence, and disorder. And guess what? People in the lower levels of the stratification system are more likely to live in those communities, right? So, we've got to broaden our focus here and think about these social determinants. Certainly there's a strong relationship between socioeconomic status and smoking. It's just what you might think. As you move down the stratification system, people are more likely to smoke. And we know smoking has serious consequences for health, and I know that's related to stress. Certainly stress is something that can seriously negatively impact our health. And there's this relationship between socioeconomic status and our ability to cope with and manage stress. Again, as you move up the stratification system, higher levels of socioeconomic status have the resources, have the social support networks that make it easier to deal with stress. Look, we all experience stress. To be alive is to experience stress. The problem is, are we able to cope with, manage, and mediate that impact of stress? And there is this socioeconomic difference in our ability to do that. And research suggests the high rates of smoking among those in lower socioeconomic status positions are in part a coping mechanism for dealing with stress. Not a healthy one, albeit, but a coping mechanism for dealing with that kind of chronic stress. Again, it's things like access to health care, which are determined by ability to pay. Can you afford health care? And is it accessible in your community? The same way we talked about, was there a grocery store in your community? Are there health care providers in your community? Are easy to access? Or again, the neighborhoods that we live in, are they characterized by social disorder? Are they safe? Can I take a walk around the neighborhood? Am I being exposed to environmental contaminants? You know, if you're living in a central city, you're going to be exposed to air pollution in a way that's not going to happen in some place like Charleston, Illinois, which again collectively has consequences for health, all of which being influenced by socioeconomic status. This has led sociologists, like most notably 2 individuals, and don't worry, there's no test, so you don't have to remember these names, Two medical sociologists by the name of Bruce Link and Joe Phelan have argued, and I think quite convincingly, that we have to understand socioeconomic status, right, a social class position, as a fundamental cause of disease. That when we want to understand what's influencing health and health outcomes, yes, we've got to look at social determinants, and they argue more broadly that something like socioeconomic status is truly a fundamental cause of disease. All right, with that in mind, with an understanding of, okay, our health outcomes, whichever measures we want to use, are impacted by these different social determinants. I suggest the most important of which is socioeconomic status. What can be done about this? Right? We're here because of a great presentation or exhibit on healthcare reform. How can this be used to inform or shape public policy? And there are some very real policy implications tied to our understanding of the social determinants of health. And let me start with mentioning a few that are occurring within the context of the healthcare institution that increasingly those that work within the healthcare system understand that the social determinants of health do matter and impact these health outcomes. And so, for example, and I apologize for the abbreviation, but I was trying to get everything onto one slide. ACA, Affordable Care Act. You might know it as Obamacare, and President Obama's finally embraced that label. But the Affordable Care Act has mandated the creation of something called the Center for Medicare and Medicaid Innovation, which is just what it sounds like. It's kind of like a think tank to kind of innovate or rethink how we deliver Medicare and Medicaid. And one of the things that they are piloting right now in about a dozen different states is they are looking at connecting Medicare and Medicaid recipients with community and social services. In other words, hey, how do we connect Medicare and Medicaid recipients with people in the community that can get them access to safe housing, that can connect them with employment opportunities, with educational opportunities, with affordable child care, whatever it may be, with the broader understanding that this is what's going to improve health outcomes and hopefully reduce spending on health care, right, if we can get people access to these kinds of things. So there are certainly responses like that occurring within the context of the healthcare institution. Another thing some of you may have heard of, again, in the Affordable Care Act, there is a mandate that not-for-profit hospitals are required every 3 years to do what's called a community health needs assessment. And this is kind of what it sounds like. It's looking at, hey, okay, what kind of needs are there in the community related to health and healthcare? And this extends well beyond just simply access to healthcare, right? In other words, are there needs for educational opportunities? Are there needs for employment opportunities? Right? These larger things that I've been discussing relative to the social determinants of health are part of this conversation. I think I mentioned just in passing, the Department of Health and Human Services has launched what they call their Healthy People 2020 campaign, which is this kind of larger national focus on preventing health problems and improving the public health. And one of the foundational pillars of this Healthy People 2020 campaign is a recognition and understanding of the social determinants of health. They're going to push this out, and so sociologists like myself say, yay, you know, anything in the social and economic realm. And then we're also seeing hospitals and healthcare agencies beginning to collect data on social determinants of health and starting to work to connect patients, people who might be coming into a hospital, into a healthcare clinic, with various social services, community services. You see this most notably the increasing use of medical social workers, right, that are helping people find themselves in hospitals or engaging in healthcare systems. And this is driven in part, make no mistake about it. I mean, hospitals want to improve their health outcomes. And one of the ways they're realizing they need to do that is to address these social determinants of health. But I think collectively that's to our benefit. And to be fair, it's really only kind of larger hospitals, particularly in urban areas, that are starting to do this. But there's I think certainly optimism and every reason to believe this will continue to spread throughout the United States. Okay, fine. So you've got the healthcare institution responding, but we also need policies and practices in what I call non-healthcare sectors. If our goal is to improve these health outcomes and have meaningful healthcare reform, which again, at the core is about improving people's quality of life. So what I mean here, we're talking about policies and practices in non-healthcare sectors. So it's things like educational policies. You know, you might not initially think about educational policies as something that impacts health, but it does. Whether it's getting people access to affordable higher education, or getting low-income families access to early childhood education, or improving educational inequalities that exist among school districts in the state. Right? All of those things can potentially help reduce those social class inequalities, right? Those differences in socioeconomic status, and in turn, improve health outcomes. Again, we've got to think more broadly here about the underlying causes of disease and then subsequently solutions. Right? So it's what we do relative to education. It's certainly economic policies. So things like job creation, right, can be understood as having meaningful health outcomes. Or efforts to, and I understand that some of these are politically loaded, but even things like efforts to improve the minimum wage, right, can start to close that gap relative to social class inequalities, and are going to have impacts in terms of health outcomes. There are various family-related policies. Could be something like getting families access to reasonably affordable and safe daycare, or leave policies when one experiences illness or needs to care for a sick family member. It's community action and involvement. It's trying to improve our neighborhoods and communities in any number of ways, whether it's like, hey, making sure we have a relatively safe neighborhood. Do we have access to parks and recreational activities in communities? And then finally, the last one I'll mention, and trust me, as an academic and as a sociologist, I could go on, but it wouldn't be fair to any of us. Even something like public transportation systems. This is one people often don't think about. But having reliable transportation can help people access employment to get to work. So if you've got a reliable public transportation system, people can get to work. And remember a few moments ago I was talking about food deserts, right? Reliable public transportation systems can get people to grocery stores. And I'm not just talking about it. Sometimes there's a tendency for people to say, oh yeah, you know, in large cities, we need these public transportation systems. We see the same challenges in rural communities where we need these public transportation systems. And we're seeing them start to develop, the federal government making some funds available for those kinds of things. But this isn't something that just happens in the city or the suburbs, and the consequences also for rural communities. So even something like transportation policies, right, and access to public transportation in so much as it can enhance opportunities for employment and access to grocery stores, again, need to be understood as having a very direct impact and an indirect impact on health outcomes. Now, let me conclude by essentially reiterating, while access to healthcare is going to remain important, and I'm at the front of the line saying we need to reform healthcare to make sure people have access, at a more fundamental level, it's really these social and economic conditions that lead to inequality, right, that are the powerful social determinants of health. Right? Our socioeconomic status shapes the opportunities and the choices that are available to us. In other words, there's ways in which our society is currently organized that are bad for our health. And we can certainly, the good news is, we can certainly reconfigure our society in ways that could benefit our health, ways that are going to reduce social inequality. Now, I'm not naive. I'm not suggesting, although in a perfect world I guess this would happen, I know we're not going to completely eliminate social inequality and social class differences. Probably not in my lifetime, at least. But what we can do is we can reduce the impact of inequality. Right? So, you know, when I'm teaching introductory sociology, I sometimes use this analogy. If you think of social class like a ladder, right, and the space between the rungs on the ladder, you know, so you have like the upper class, middle class, working class. Okay, you look at the gap between those rungs. What I'm suggesting is if we could just reduce that, right? We reduce the amount of inequality between those at the top and those at the bottom would go a long way towards improving health outcomes. Thank you.